Hi there. My name is Christine Leischen. I am the CARES Program Manager with the Upper Arlington Fire Division. CARES is our approach to community paramedicine. My background is in gerontology, and I've been working with older adults and frail populations in a social service capacity the last 15 years. I work alongside 2 community paramedics, and together our CARES program can provide assistance, referrals, and education services to local residents. Today, I'd like to spend a few minutes sharing the value of community and academic partnerships from a fire division perspective. Reiterating a little of what firefighter Wisner shared during his presentation, fire divisions are well known for fighting fires and responding to medical emergencies such as car accidents, heart attacks, difficulty breathing. You get the idea. While these remain to need a critical and timely response, 911 calls also occur for a wide variety of non-emergent needs. Like most other fire divisions in Ohio and around the country, we started noticing the increase in the amount of lift assists or calls to help someone that is not injured but may need help off the floor or transitioning from a bed to a chair. We found ourselves in a position to now fight falls. This change in culture shift led to the development of our CARES program and our popular grab bar installations. We didn't get there overnight. We were fortunate to have met caring and passionate individuals as part of a research team at The Ohio State University, around the time our division was wanting to tackle falls in our community. You may have already heard shared in other presentations today the concept of moving from reaction to prevention, which can also be termed as moving from downstream to upstream. Our team has learned more of this concept, and our program is hugely successful because of the partnership we have with The Ohio State University. Highlighted here in 3 pictures are our CARES paramedics that switched their firefighter uniforms for a day to walk in the shoes with an orthopedic surgeon, Dr. Carmen Quatman. They experienced falls through a different lens. Through meetings, collaboration, and several grants that were funded, we worked together to shift our focus towards fall prevention. So, this necessary upstream thinking, in order to help solve a downstream problem, has some simple key steps. As outlined in the book, Upstream, The Quest to Solve Problems Before They Happen by Dan Heath. I highly recommend you read or listen to this book. First, in order to avoid problem blindness, we must be able to see the problem. We collected data on the number of falls that were occurring in our community as a tangible needs assessment and baseline for program implementation. We know falls are occurring, but taking it a step further and determining the common situations in which they're more likely to occur, reviewing what solutions may exist or are possible, and pursuing the necessary legal and logistical aspects to fill the gaps and overcome the barriers. Next, you must take ownership of the problem. We could easily say, falls are going to happen no matter what we do, or falls are just a normal part of aging. By realizing that the fire department is in many ways in an ideal position to help prevent many falls, we are taking stake in helping to fix the problem. We consult with experts, partake in quality improvement sessions, and network with other providers to support, encourage, and strengthen our efforts. The third key step is to avoid tunneling and make the time to work on the problem. There are a lot of demands for time these days, and there are not enough hours in the day to get it all done. When we collectively focus on the problem, agree on a process, and prioritize the plan, we start to see outcomes. Simply put, what gets fed will grow. By partnering with the Ohio State University research team, CARES has been able to take action upstream. Prior to or after a resident falls, we can conduct home safety assessments and recommend modifications as well as install grab bars. To date, we've installed over 700 grab bars. While it is always a challenge to capture prevention work, or in this case, the number of falls that were prevented, data after implementation shows a decrease in the total number of fall calls by month, which is against the trends. In addition to publishing quantitative data, we've compiled anecdotal and qualitative evidence to support our upstream approach. This partnership is one example of the possibilities for your program and community. There is so much value in the connections and brain trust, learning from other experts, and literally walking in their shoes. I hope you've already begun thinking of similar upstream partnerships with one or various providers and industries listed here. As a nod to our partners at The Ohio State University, we encourage you all to share seamlessly and steal shamelessly. We want you to be inspired and motivated to be a part of culture change and to know that you can make a difference. Thank you.
Hi, my name is Catherine Quatman Yates. I'm a physical therapist and researcher by training. I'm on faculty in the physical therapy program at The Ohio State University in the College of Medicine. And for this particular presentation, I'm going to talk for a few minutes about building academic community partnerships to transform fall-related outcomes. And specifically, I'm going to talk about our experience in working with Upper Arlington Fire Division and others to help share our understanding, resources, and trainings to be able to help work together to make transformative outcomes happen. Our story began with when we actually encountered each other at an arts festival and began talking about the common problem of liptocysts and falls in vulnerable individuals' homes within the community, and how first responders are often the ones that are most knowledgeable, have the inside information into the house, into the community about the resources that might be available, and have some opportunities to partner with different groups to understand how to use the data that they have coming in to their benefit, to improve their own operational systems, as well as to partner with researchers and other groups to be able to identify what are best practices and how can you best implement them in your specific context. And so we started out with what we call Gemba walks, where we walked in each other's shoes, including having the paramedic group come and observe and watch the pathways to surgery for after someone falls and has to have an operation. And we put on the gear ourselves and rode in the fire trucks and went on some home visits to see how Upper Arlington Fire Division CARES program was working on working with their community members and just various health service care coordination pieces. After a little while, we began to actually merge our efforts to try to bring in other stakeholders, including additional researchers, a different type of clinicians, nurses, and physicians, and different groups, occupational therapists, speech therapists, to begin meeting and just sharing ideas and thoughts and brainstorming and trying to put some action plans together. We called the group the Community Fit Stakeholder Collaborative, Community Fit standing for Community Centered Fall Intervention Team. And here's an example of one of our meetings where we're all working together. Our approach to working together involves a direct overlap in terms of our research efforts and methodologies and quality improvement efforts and methodologies. And in the process of doing both of these things, we were helping to train our community partners, and they were helping us to learn the context in order for us to really help each other move our initiatives forward. So along with this, we wanted to share some key findings about how this beneficial academic and community partnership was really effective. One of the big key learnings that we had was that, by finding and helping the most vulnerable people, that really among all the calls that they were receiving, there was a certain set of highly vulnerable and increasingly vulnerable individuals, and it wasn't always just age-related. But could we target those individuals to help them improve their capacity to be safe at home and not fall as much, which would then result in fewer calls to the paramedics for lift assists and potential injuries? And so this is an example of a graph for an individual in the community of Arlington who had been calling frequently each month for several months. Then they began to work specifically with that individual in the community paramedic program to help address some of their common risks. And over time, we saw the number of calls related to falls that this individual was putting into the EMS service go down significantly and stay very low over time. When you combine that at the entire community level, we had some great success. So they put efforts in to really target their most vulnerable individuals and provide some fall prevention efforts. And over time, what they actually saw was, as they put more and more people through the program, a dramatic reduction in the number of fall calls they were receiving over time, and also a dramatic decrease in the percentage of fall-related calls resulting in hospital transport over time. I put a link on this slide here that you can go visit, which is attached to the paper where we provide more specific details about the interventions that they put into place to help see these results. Other key learnings. What we learned very quickly was how it was so important for the leaders within the EMS service, the staff and the community itself to be on board with moving forward with our initiatives. It wasn't just a matter of one stakeholder group committing, it was a matter of getting everybody on board with sort of a unified vision in place and trying to work together to accrue resources and use those resources wisely. Another key learning was how we approached the funding. We really started small and diverse to focus on local implementation. One of the benefits of merging with the academic and community partnership was that, the academic group was able to have experience writing grants and securing funds and managing implementation of research and quality improvement initiatives. And so through a number of funding mechanisms, including some philanthropic donations, some National Institutes of Health, some local community grants, we were able to combine together a number of pretty significant resources over time to really put some resources in place for things like grab bar installation across the community for highly vulnerable individuals. And so the key learning here is really consider starting small and diverse and to focus on getting funding for your local implementation. And then from an academic standpoint, one of our big pushes is to get these bigger funding mechanisms in place so we can actually have population health changes. And so the partnership with the academic units can be really powerful to securing high-level funds and spread. Another key learning was that we need to be able to connect information sources. We need to create information systems to adequately track information about patients that can then feed back to the 911 scene. And we were able to bring in some clinical informatics specialists and partner directly with the community paramedic groups and people who are on the front line to say specifically what would be helpful to them and then help them learn how to connect and get resources to connect some of their communication systems that was making it really powerful for them to be able to identify who was at highest risk and then respond quickly. Another big key learning was that we had to work together to get creative solutions in place. We had some industry partnerships, flexible thinking, making it standard of care. We learned early on how difficult it was for individuals who needed grab bars to have grab bars actually get installed. Lots of questions about where should they be installed, and how do we pick which grab bar it is, and what would be a safe installation process. And so our firefighter friends noted that they were able to install fire alarms and that they were willing to learn and really get good at installing grab bars. And so this is actually them training each other about how to effectively install a grab bar, which opened up the number of opportunities they could present to their community members in terms of offering quick installation of grab bars rather than waiting for the patients themselves to figure out how to make that happen. Another big key learning was getting the safety net in place, that we were able to kind of work together to help coordinate some resources in the area specific to the community that would really help the residents involved. And working hard to make it sustainable. So our partnership allowed us to have some, forward thinking types of ideas in place about how we were going to keep the funding going, and how we were going to make sure that they were able to sustain the funding even when the grants ran out. And they came up with a lot of different creative ideas, including a pay it forward campaign where people could donate to help their own community members get grab bars installed by covering the cost of the future ones. So that there was no cost or charge for them, but if they wanted to contribute to a neighborhood type of paying it forward campaign, they were able to do so. And the biggest piece here is really we were able to get data to show the effectiveness of our model together by having the researchers and clinicians involved along with the community partners. We were able to get the modeling of the data in place to show how effective our efforts were, which then could result hopefully in future policy changes and also help commit at the city level continuing funds to support the initiatives that they were in place. And finally, I'd like to talk a little bit about the life-changing relationships that we formed through this partnership. We really built bonds with our community partners and became, friends and partners in more than one initiative. And that ongoing relationship building has allowed us to contribute to be successful and ensure the sustainability of their efforts and being able to serve their community in new and innovative ways. So thank you for your time for listening. Feel free to reach out with any questions or concerns.